Our lovely patient, who's 38 years old, is a month out from her abdominoplasty, hernia repair, and breast augmentation with her own tissue, as well as the rectus diastasis repair. And she's come back in recovery. She's come back in through her recovery and her follow-up at 1 month, and she has very graciously agreed to share some of her thoughts and feelings about what were her hopes and aspirations and what her entire experience has been like.
Hi, my name is Debbie, and my experience coming here was just unbelievable. For a long time, I've been wanting to go through this procedure, and when I finally decided to do it, it was unbelievable because afterwards, the recovery was just so nice, and Dr. Claytor was amazing, and going through it all, I just felt uncomfortable in my own skin with my belly. No one really could tell from the outside, but from the inside, it was, looking in the mirror, it was just never, after having 3 kids, it was just not what I liked looking at. So when I came here and we did the procedure, it just changed everything. So I'm very grateful.
You're wonderful. You're wonderful. Let's talk a little bit about your unique experience. Your abdominal tissue was pretty stretched out, not just on the outside, but also on the inside. And so when we were fixing everything and tightening you up, we talked about what to do with your belly button.
Right.
Do you want to share some of your thoughts and feelings about your belly button and what we did?
Yeah. Well, you had to make a new one.
Yeah.
Because I didn't have one because of all the loose skin.
It was so blown out.
Yeah, so I didn't have one, and you created a really, really nice belly button for me. And, massaging around the area to help loosen up the skin from, adhesing or whatever it is. But, yeah, I'm very happy with it.
Love it.
Yeah.
Love it. Yes, absolutely right. When we fixed your hernia and repaired your rectus diastasis, your separation was, I think I remember telling you, it was one of the most dramatic that I had seen. I think it was upwards of 8 to 10 inches.
Yeah.
And in the process of that, it really necessitates making a new belly button, which yours has been fantastic. 8 to 10 inches, is that right?
Yeah.
I think it was probably closer to 8, but it was really quite dramatic. In terms of postoperative recovery, we've really pioneered and perfected not using drains. Can you speak to what that was like?
Yeah, I've heard about the drains, and the reason why I came to you was because of the drainless tummy tucks. I was up and moving around the first week, even though I was on pain medicines and a walker and all that stuff. But, I was mobile. I didn't have to worry about things coming out of me. I was able to feel more comfortable, getting up and out and not have to worry about the drains. So.
Yeah, they're not necessary, and I think they dramatically accelerate your recovery process.
Yeah, and you're worried about infection and keeping it clean, and then if it falls out,
it's painful, and how do you get the binder on also, so you don't have to worry about any of that.
Yeah.
Can you speak a little bit to my prophylaxis protocol, where we were doing the leg sequential compression devices as well as the Lovenox injections?
Yeah, so I thought that was genius. I mean, from a medical standpoint, I was just like, it's, you got to be mobile after surgery. So having the leg compressions on 24 hours, it was difficult, but we did it. And after a week, you said to stop. And the Lovenox shot, my husband was gracious enough to assist with that.
He's over there smiling. We're giving him a big thumbs up.
Yep. So it was fine. It's just something you had to do.
Yep.
Yeah. So.
In terms of your chest, how do you feel about your supplementation?
More confident. Yeah. Everyone was like, fat grafting, I didn't know you could even do that. And it's just a little poke hole, incision. And that was the easiest recovery. That was nothing compared to, the bigger incision. So I was grateful that we were able to do it all. So
make it all happen. Rather than just throwing away that fat. We repurposed it.
Yeah, and it really is, it's great.
It's awesome.
Yeah,
it's awesome. So here at a month out, I frequently will tell patients that a month they can and should be able to do pretty much any activity. Is that true
Yeah.
for you?
Yeah, I mean, it is still sore, but, you know, I can do everything that I normally would do. You just have to be careful.
Perfect.
So, yeah.
Many patients ask, is this something that you would recommend to a friend?
Of course, I would. I mean, if someone was struggling with their abdominal areas, I mean, even my sister, I was like, you got to get in there and do it because it changes your whole body and how you feel and the way you wear your clothes. It's really special.
If you could sum this up in one word, would the word confidence be appropriate?
Yeah, it would be.
Well,
Yeah.
Thank you so much.
And feeling stronger
There you
in your
go.
own body with your abs
I like
being
that.
back together again
I
where
like
they're
that.
supposed to be. So, yeah.
I like that addition.
Yeah, thank you.
Well, thank you for sharing your story, and I know that our patients will enjoy hearing your journey.
Thank you, Dr. Claytor.